Welcome to Phlebotomy Fundamentals. In this video, you will learn proper step-by-step phlebotomy techniques from the time of patient greeting to the close. Let's begin. The greeting. Proper greeting technique will build a solid rapport between you and the patient and falls into two parts. First part is calling the patient by their last name. The second part is the introduction. For example, "Hello, Mr. Smith. My name is Anthony, and I will be your phlebotomist today." It is also important that you have direct eye contact with the patient. When possible, extend out your hand to give a handshake. Confirm the identity of the patient. Once you have greeted the patient, ask the patient to say their first and last name and date of birth.
Can you please repeat your name and your birth date for me, please?
Jane Doe, 6/18/76.
6/18/76. Okay.
You can also go as far as asking the patient to review the lab slip for proper spelling of their name and date of birth. Should there be any discrepancy with either their name or date of birth, stop and advise the patient of the discrepancy and that you need to correct it before drawing their blood. Under no circumstances should you handwrite the correct spelling of their name or date of birth. Explain the procedure to the patient that you will be drawing some blood for tests ordered by their provider.
So what we're going to be doing today, we're going to be doing 2 tubes. Okay, and then you've had this done before.
Yes.
There's nothing happened to you, everything went well.
No.
Okay, I'm going to put this down for safety. All right, and I'm going to take a look at your arm, all right?
Place on gloves. You can place on gloves prior to the procedure. However, it can make palpating a vein a little more difficult.
I'm going to try to tourniquet.
Now that you have properly identified the patient, place the tourniquet around the patient's arm, approximately 2 fingers from the collection site.
Just going to take a quick look at your veins, okay? All right. It's not so tight, okay? Is it okay like this?
Yeah, that's good.
Begin palpating the site for a suitable vein. A suitable vein should have bounce to it.
Give me the fits for me. Perfect. All right. You have excellent veins, okay?
Should the vein feel hard, stringy, or feels like it can collapse, begin looking in other areas of the arm, forearm, or hand. The hand should be the last resort. Once you have palpated a suitable vein, remove the tourniquet.
I'm going to take this off. Okay.
The tourniquet should not remain on the arm longer than 1 minute. Should the tourniquet remain on the arm longer than 1 minute, hemolysis will begin, which can cause the test to become void or the results can become altered, giving the provider incorrect results. Prepare materials. Begin preparing your material, such as the gauze, tubes, and needle.
I'm going to get my tubes ready.
In addition, you should never prepare your needle prior to palpating the site, as this can cause you to possibly prepare the wrong gauge needle, which can no longer be used and must be discarded. If you feel you need to feel for the vein prior to inserting the needle, touch the finger with some alcohol, and under no circumstances should you remove a piece of the glove to feel for the vein. This not only will recontaminate the site, it is also an OSHA violation. Insert the needle. Place the tourniquet. Stretch the skin to keep the vein in place. Use the opposite hand to insert the needle bevel up. Under no circumstances should you ever switch hands. This can cause the needle to move around in the patient's arm and can also cause pain and hematoma.
Put this back again, okay? And this is not too tight. Okay, smell it? Okay. This is my needle. If it hurts you, it might hurt just a little bit, okay? And I'm going to state it might hurt just a little bit, okay? Okay.
Remove the tourniquet prior to 1 minute. In some cases, when you have a patient who may have poor veins, keeping the tourniquet may be necessary. Should this happen, you should document it.
And just two.
Begin collecting blood. With the opposite hand, begin collecting the blood using proper order of use of tubes.
I'm going to do the twist to change. Okay. Can I punch in your face?
Remove the tube. Upon removing the tube, remove the needle. Never remove the needle with the tube remaining in the adapter. This can cause some blood to spill out of the needle.
Okay.
Apply gauze. Upon removing the needle, place gauze on the puncture site and ask the patient to hold the gauze in place. During this time, you should also discard the needle. Prior to placing the bandage, you should also label the tubes. This allows the patient to see you have placed their name on the tube prior to discharging them. Should you have a patient who is unable to apply pressure to the site, you should prepare bandage ahead of time and apply the bandage upon completion of the procedure.
Welcome. So your name is Jane Doe.
While applying the bandage, you should ask the patient if they are on any blood thinners, such as Coumadin. If the response is yes, then ask the patient to keep the bandage on for a minimum of 30 minutes. If the patient is not on any blood thinners, then the patient can remove the bandage after 10 minutes.
Okay, it looks pretty good. It doesn't hurt, right?
No.
Okay, perfect. Just mark with this. Put your arm up to me just a little bit.
If the patient does not want a bandage, advise the patient it is protocol since there is now an open wound and the purpose of the bandage is to prevent infection. Thank the patient. Once the phlebotomy procedure is complete, with eye contact, thank the patient.
No pain.
No pain.
If you do feel pain, and you can always put some ice to it. If it get worse, you can always call your doctor or come to emergency room. We'll take care of it, okay?
Thank you.
All right, and you're all set.
Thank you.
Have a wonderful day.
You too. Thank you.